Exposure to COVID-19 is defined as being in close contact with someone. If someone in your household has tested positive for COVID-19, or if you've had a close contact. A close contact is a household member who has tested positive for COVID-19, or it's someone that you've been in close proximity with, so within 6 feet, or if you've been unmasked in close proximity to that person and they've tested positive for COVID-19. And just keep in mind that the person who tested positive for COVID-19, they were contagious 48 hours before their symptoms even appeared. If you have received your booster, or if you've had your primary series of the Moderna or Pfizer vaccine within the past 6 months, or the Johnson & Johnson vaccine within the past 2 months, then you do not need to quarantine, but you do need to be extra cautious by wearing a reliable face mask covering your nose and mouth, which is the surgical mask, the KN95 or the N95 mask, for at least 10 days. You also want to be washing your hands and also avoiding large social gatherings and self-monitoring. So if any symptoms occur, such as a scratchy throat, nasal congestion, cough, fever, body aches, chills, loss of taste or smell, you would want to get tested. If you have not ever been vaccinated for COVID-19, or if it's been longer than 6 months since your initial series of the Moderna or Pfizer vaccine, or longer than 2 months for the Johnson & Johnson vaccine, then you would want to quarantine for 5 days. So you want to stay home, not go to work or school, and you'd want to self-monitor. Have you had any scratchy throat, any low-grade fever, chills, body aches, cough, shortness of breath, loss of taste or smell? At that point, you would want to get tested and isolate yourself from all others. If you don't ever have symptoms over that 5-day period, you can return to work or school and continue to be vigilant with wearing your face mask and hand hygiene and avoiding large crowds. You have 2 different pathways depending upon your vaccination status. So if you've been boosted or you've had your vaccine series in the recent past, meaning within the past 6 months, then you don't need to quarantine, but you need to be wearing a reliable face mask, face covering, and monitoring yourself for any signs or symptoms. If you have not been vaccinated, or if it's been more than 6 months, you've not received your booster, then you'd want to quarantine for 5 days. Keep a close eye on your symptoms. If you develop any, you would want to get tested within 5 days of that exposure.